burning question, MDMS or DNB? Now I would like to call upon Dr. Syed Samila to talk a little bit about this concept.
Thank you, Sridhar, for asking me to speak about MDMS versus DNB. As we all know that after finishing that NEET PG examination and getting a rank, everybody will have a branch in their mind. But again, selecting a branch in itself is a very confusing process. But later to that, when they give two options between MD or MS, the students are still more confused. So what we can do to jot down is, in this session, we can say that if we academically, if we see both are on par with each other. First of all, like my dear colleague Dr. Sheikh Wasim stated, that DNB is also a 3-year course which is offered by MBE, and MDMS is offered by the private colleges and the government medical colleges, to be very specific. And both are on par with each other. Whether it be any branch, it doesn't matter, they are on par with each other. So I am personally, being from a general medicine background, I would actually speak more about MD general medicine and in relation and contrast with DNB general medicine. How does it have its positive and negative?
Now, little bit of this controversy prevailing around the spectrum, whether the MDMS is on par equivalent to DNB or not. I would like to call Wasim sir again to talk a little bit about the government GOs related to that, whether it is really on board or not, whether it is really there in the practicality, the par equivalence.
See, regarding the equivalence, there is a very important. I would like to take 2 minutes to clarify this. Previously there was something called as MCI. It was called as Medical Council of India. Now the governing body is replaced by NMC, National Medical Council. Okay, so the NMC overlooks over all the governing bodies, the PG courses all over India. So now the point is, NMC will be releasing teacher equivalent qualification regulations, TEQ, on a regular basis. The last one was released in 2018 and the revised one is released in 2022. So the 2022 National Medical Council Teacher Eligibility Qualification states, DNB, if done from an hospital of more than 500 beds, is equal to MDMS in all aspects regarding the teaching faculty in a medical college. No confusion. If DNB is done from an hospital with less than 500 beds, then such candidate have to do an additional year of senior residency in a NMC recognized medical college to be equivalent to the teaching faculty of MDMS in a medical college. To make it simple, if you did your DNB from a hospital greater than 500 bed, you are equal to MDMS regarding teaching faculty. Okay? If you did from less than 500 bed, you have to do 1 more year extra of SRship to become eligible as a teaching faculty. Okay? So here the teaching faculty is again divided into different hierarchical levels. Teaching faculty level starts from senior and assistant professor.
So this is basically you are told exactly what is required in a very clear manner, sir.
If you want to practice in a general practice, if you want to come out as a specialist, DNB and MDMS are same. There is no difference. You did not do anything extra. Only if you want to become a teaching faculty in a medical college, if you are doing DNB from greater than 500 beds, you have to do 1 year SRship to be eligible to be AP. If you do from less than 500 bed, you have to do 2 years of SRship to be eligible to become assistant professor. That's all. That makes a difference. In real practice, either you be DNB or MDMS, you are a specialist, you are liable to practice. And regarding the corporate and the government sectors, in government jobs as well, DNB is equal to MDMS. There is no difference regarding that. Government jobs, like in the government sector. Even in the private sector also, it is similar. Only when you want to join a medical college and an NMC recognized medical college as a teaching faculty, this question of less than 500 and greater than 500 beds arises. Thank you, Shri.
So when we are thinking about the post-DNB or MD scope, we need to consider all this job aspect and career aspect. So for the aspirants, sir, to enter into MDMS or DNB, suppose if you want to put a rhetorical question here, whether to take MDMS from an average tier 3 city or DNB from a corporate hospital of tier 1 city, like metro cities? I think Dr. Sayan can take up this question first.
Thank you, Dr. Sridhar. And yes, your question is very valid. Whether to take a DNB from corporate hospitals placed in the metropolitan cities or the tier 1 cities, or to differentiate it between MD from an peripheral institution. Let me talk about DNB first, because since I am from a DNB background, DNB in metro cities, I feel, would be far better, because one of the reasons is NBEMS has a perfect academic curriculum where every week there would be classes. That is directly coming from the center, from the NBA board. Second, the hospitals conducts, in terms of academics, first speaking, hospitals are liable to conduct every week one class and every 15 days one journal club. And let me add, in the metropolitan cities, there would be association of DNB doctors, and there would be every week one of the clinical sessions where all the DNB doctors will be aggregated in one place, and then there would be a clinical discussion. So academic wise in DNB, it is as good as MDMS.
Thank you.
This is in metropolitan cities.
So now I would like to take the answer from Dr. Rishant, who is right now doing residency in a corporate hospital. So he could give us a much perception of what it is happening among the colleagues, especially in the field of pediatrics, where he is practicing. Yeah, Dr. Rishant, please.
Yeah, first thing I want to clear is whether MDMS is superior and DNB is inferior, because everyone's mind will be like DNB is a superior one. But first thing I want to say is, since 1975, the Ministry of Health and Family Welfare started this autonomous board, the National Board of Examination, which is conducting a DNB Diplomate of National Board since 1975. So that is the first thing I want to clear. So it is almost around 30 to 40 years that DNB courses are running in India of post-graduation of medical examinations. So next question is whether to choose MDMS or DNB. First thing, after everyone has got the results and everyone has got very good results. And first thing you have to keep in mind is choose your career option. First you have to choose the branch, then comes the degree. So whichever branch you are interested, that only you are going to practice for a lifelong time. That thing you have to keep in your mind. Then choose whether it is MD or MS or DNB. Then next comes the question whether to choose DNB from a very good hospital or MDMS from an average institute. I will suggest definitely DNB from a very good institute, we have to choose it. But MS or MD from an average institute, you can definitely go for it. But at the end of the result, whether DNB from a very good institute or MDMS from an average institute, the candidate should know all the skills during the post-graduation period. That is the thing the patient should be expecting after your degree, and the approach, how you are approaching and finding the diagnosis, how you are going to treat the patient. That is the thing the patients are expecting from us. And the next thing is MD, MS and DNB. So basically MD, MS is a medical college and DNB is from a hospital, like a corporate hospital, or it can be a mission hospital, or it can be some district hospital also. So MD, MS, their curriculum, academics curriculum is entirely different. DNB curriculum and academics is entirely different. I will say about DNB academics. So basically this is an autonomous board and it has given certain curriculum for the hospital, and every 2 years to 3 years the NB is coming to the hospital and they will conduct they will conduct all the documentation on what is the case load and what are the procedures going on, whether this hospital is suitable for this DNB seat or not. Then only the NB board will give approval for the hospital. So definitely if the hospital is having a DNB seat, the NB has seen all the criteria for the hospital, then only the NB will give the seat for the hospital.
Yes, thank you, Dr. Rishant.